We're talking today about how these trying times can make it hard for people to maintain their sobriety. In season 15, my guest Nikki was homeless, pregnant, and addicted to heroin. She had been in rehabs and treatment centers in the past, and it wasn't until we sent her to treatment and she properly learned the 12 steps of Alcoholics Anonymous and introduced structure in her life that she finally found sobriety. And she's joining me today, 3.5 years sober, and actively sponsoring multiple people and working as a supervisor at a substance abuse and mental health treatment center. So, Nikki, it's so good to see you and hear from you, and congratulations on doing so well.
Thank you, Dr. Phil.
So, this is a very different time. None of us have ever been through anything like this. And for those in the sober community, it is really presenting some challenges, particularly with regard to newcomers that are fighting for their sobriety initially. Tell me about what those challenges are.
Absolutely. So I know when I first got sober, I found so much solace in the clubhouses and the fellowships that welcomed me with open arms. And people who are just getting sober, who are reintroducing themselves into the community, they don't have that right now, that face to face contact.
And so, what you're using now are Zoom sessions like you and I are on right now. And that helps. I mean, it's clearly you at least have the contact and you can talk about the ideology and the 12 steps and the things that are important. But that human experience, that personal closeness and intimacy where you can really share, sit down with somebody, whether it's on the curb or on a chair or somewhere, that's what's missing, right?
Yeah, definitely.
And there are some new warning signs to look out for during this time when people are isolated. Talk about what those are.
So it's hard because we're coming from this self-imposed isolation that we've become so used to for so long, and now we're told we have to re-isolate essentially. So while people are trying to get sober during this time, it's absolutely imperative that we maintain the physical isolation that the CDC is setting forth and all that. But
Right.
there's no need to have that total mental isolation, and that can still happen. It's a little harder to see when someone's withdrawn because you don't have the normal face to face when you see someone stop coming to a meeting, when you see that um they're not answering the group text as much, they're not showing their face or doing service work. But luckily, with the technology we have, we all still have cell phones. We're trying to utilize group texts and Zoom messages. My sponsorship family is big in the group text, so when people stop reaching out, we can still see that it's not quite the same, but we can still feel the isolation when someone's pulling away.
Right, of course. And, Nikki says that even though we don't have these personal connections that you can do in the real world, it does help to have the technology, but there's even more that we can do in a peer to peer relationship.